Okay, now we can talk about fibromyalgia. Fibromyalgia is a chronic, non inflammatory pain syndrome that's characterized by widespread musculoskeletal pain and accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way the brain processes pain signals. Symptoms can sometimes begin after physical trauma, after surgery, infection, or significant psychological stress, but in other cases, the symptoms just gradually accumulate over time with no identifiable single triggering event. Women are more likely to have fibromyalgia than men. And many people who have fibromyalgia also have things like tension headaches, mandibular joint disorders, so that TMJ in the jaw, irritable bowel syndrome, anxiety, depression, chronic fatigue, etc. There's no cure for fibromyalgia. A lot of medications can be used to help control the symptoms. Exercise, relaxation, stress reduction can also help. Some of the signs and symptoms include widespread pain. The pain associated with fibromyalgia is often described as a constant dull ache that's lasted for at least 3 months. So diagnostically, it has to be at least 3 months in duration. Also, to be considered widespread, the pain has to occur on both sides of the body and above and below the waist. Also, there needs to be fatigue. People with fibromyalgia often awaken tired, even though they report sleeping for long periods of time. Sleep can be disrupted by pain, and people with fibromyalgia also have other sleep disorders such as restless leg syndrome and sleep apnea. There's also some cognitive difficulties, symptom commonly called fibrofog, and it impairs the person's ability to focus, pay attention, to be able to concentrate on mental tasks. As I said, doctors don't really know what causes it, but they think there are a variety of factors. Genetics tends to run in the family. Again, this is something that I have. My daughter also has fibromyalgia. They think it may be related some way to infections, because some conditions have been known to trigger or aggravate fibromyalgia, physical or emotional trauma, car accident, or psychological stress. So they don't really know for sure. Excuse me, but there's been correlation with other things. One of the questions is, why does it hurt? And researchers believe that this repeated nerve stimulation causes the brains of people with fibromyalgia to change, and the brain interprets pain differently. So the change involves an abnormal increase in brain chemicals that signal pain, so those neurotransmitters. And also the brain's pain receptors seem to develop a sort of memory of the pain that becomes more sensitive, and it causes a person to overreact to pain. Now, this doesn't necessarily mean that a person with fibromyalgia experiences more pain in other situations. I can give you a perfect example. I was diagnosed with fibromyalgia many years ago, and I have the widespread pain, but I also have 13 tattoos, and I am able to manage that pain. Actually, in some instances, I've been described as having a high pain tolerance. So it really is pain that's isolated to specific areas, and again goes to how the brain changes to interpret pain in those areas based on past experience. So it's a really interesting disorder. Now, fibromyalgia is something that has been the subject of skepticism in many medical circles. It took me personally 6 years to get a diagnosis because they couldn't identify what the symptoms were. And a person with fibromyalgia tends to go through a lot of testing of more to rule out other things. I've been tested for lupus. I've been tested for, it's a laundry list of things that I've been tested for. And it can lead to depression and anxiety on the part of the person because you know that there's something wrong, and these healthcare professionals continually telling you that there's nothing wrong. So, that's something I personally experienced for 6 years, and there are many people with fibromyalgia who have stories just like mine. So, that can be cause additional problems. So, in the past, for diagnosis, there used to be trigger points. They still kind of use the trigger points, but the doctors would check out these 18 specific points on the person's body to see how painful or how much pain the person experienced when they were pressed firmly. Newer guidelines don't require the tender point exam, but more look at whether the person has experienced widespread pain for at least 3 months with no other underlying medical condition for the pain. So other tests might be done, but in general, it's to rule out other things. So fibromyalgia is often treated with medication and changes in self-care. Really looking at the person's quality of life and how their lifestyle can be changed to be able to manage the pain and improve sleep. That's important. Some medications are over-the-counter pain relievers. I tend to just take NSAIDs. One of the things that is prescribed quite often for fibromyalgia is antidepressants. And it's not because the person is experiencing depression, but it's because the antidepressants can block the pain receptors, and that's shown some positive outcomes. I was briefly on antidepressants. I didn't like them, so I'm not currently on antidepressants, but it is something that's routinely diagnosed for people with fibromyalgia. Anti-seizure medications are often also used. Gabapentin or Neurontin is sometimes helpful in reducing symptoms. Therapy, physical therapy, OT are also helpful managing your stress if that's something that exacerbates the fibromyalgia. Sleep is an important thing. Regular exercise has been shown to have an improvement in fibromyalgia. However, it can be challenging to convince a person with fibromyalgia that exercise is possible because of the pain. So it's finding that level of participation that the person can tolerate and being mindful of pacing themselves. Healthy lifestyle, limiting caffeine is important, eating healthy. Acupuncture has been used for people with fibromyalgia. Massage therapy, but again, I want to preface this with depends on the person. Personally, I hate massages. I don't want anybody touching. It's that deep pressure, what they use diagnostically, and it's painful. So you want to consider the person and where the massage is happening. And yoga and Tai Chi have been used as treatments for fibromyalgia. Okay, that's it for this topic.